Okay, welcome to another episode of the Power Panel brought to you by MYOS MD. So let's hop right into the topic at hand. First and foremost, we'd love to have an intro from our guest today. Would you mind giving a little background on yourself before we get into today's topic?
Yes, ma'am. Thank you so much for having me, by the way, and it's great to see you again. My name is Dr. Alfred Alessi. I own a clinic in Tampa, Florida, called Alessi Functional Health, where we specialize in a few different things. We really have three pillars of how we practice, but the physical medicine, which is a chiropractic, spinal decompression, really focused on, getting people functional. And then functional medicine, which is very much a growing part of our practice, using comprehensive blood work, testing, gut testing, all kinds of stuff, really getting in detail with people to get to the root cause of what their issues might be. And then we're tapping into regenerative medicine as well, utilizing things like peptides, regenerative medicines like stem cells and soft wave therapy, which is really cool stuff. We just invested in a whole body red light therapy system, which is going to be awesome for our patients for inflammation. So, realistically, our goal is to kind of upset the conventional medicine model and get people better instead of just keeping people sick and unhealthy and on pills for the rest of their life.
Amazing. Yeah, thank you so much for that introduction. So before we dive into today's discussion, I wanted to mention that today's Power Panel is brought to you by MYOS MD, the cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortitropin, a natural bioactive compound which has been clinically shown to enhance muscle growth and reduce anabolic resistance, MYOS MD is changing the way we think about muscle health. So if you'd like to learn more about MYOS MD, you can go to myosmd.com. Alrighty, so into today's episode. So we want to focus today quite a bit on functional medicine. We haven't had an expert yet, dive into that topic. And so how do you define functional medicine and, what got you interested in it in the first place?
Yeah, the concept of functional medicine is really what it's called, is that we're trying to optimize the way the body functions, and the way the body functions is as a system, not just a bunch of isolated organs talking to each other, right? And so everything is connected. If someone comes in with chronic joint pain, or say it's fatigue, or they're having cognitive issues, often I'm looking at the gut, because the gut is our first barrier of defense for our immune system and for where that inflammation may be coming from. And so again, in conventional medicine, docs are not going to take that out of the box approach. And so we really focus on, again, like looking at the patient as a whole and not just a list of symptoms and lab values, because you can often get lost in the numbers of, oh, the cholesterol is high, let's do this, or, the inflammation is high. It's like, how is their lifestyle affecting that too? So we incorporate lifestyle a lot within our clinic, because that's, that everything starts at home realistically with how our patients' lives are going. And so to answer the second part of that, I got into functional medicine, really my own story. It started as becoming a chiropractor due to an injury I had really good results from chiropractic care. And then, started learning more on the functional side, had a lot of nutrition training through that. I've always been more health conscious as even growing up. And then diagnosing myself with an autoimmune condition, actually Hashimoto's thyroiditis, where I didn't know anything about it at the time. I ran some blood work, and as I was tapping into it, I found that standard labs missed it, because they just ran a thyroid stimulating hormone test and a T3, which, I was in the normal range. It wasn't until I ran an antibody test and found that I had presence of antibodies attacking my thyroid, and then took action on that. Went down the whole rabbit trail of healing the gut, right? Fixing the leaky gut, balancing stress levels, cortisol, all the adrenals, and ended up actually getting remission from that autoimmune condition, where my antibodies are now within a normal range and not clinically diagnosable as Hashimoto's. And so I think experiencing it myself is what kind of gives me the passion and the empathy to really be able to talk to patients about the power of functional medicine.
Yeah, that's incredible. So many people that I've met that are either in functional medicine or in integrative medicine. I'm an integrative specialist as well. I think so many of us come from the personal experience, whether it's, something that we experience or one of our loved ones or someone in our community experienced. And then we kind of take it from there and realize that there's more than one way of just healing. So
That's right.
Definitely. So let's talk about some examples. So when a patient presents to you with fatigue or brain fog, what are some of the root causes that you look to investigate first?
Yeah, kind of what I alluded to just now is the fatigue and the brain fog are really just their signs or their symptoms. They're the check engine light, right? Or the alarm that's going off within the body. And so now it's okay, like, where's the fire, right? If the fire alarm's going off, where's the fire that's causing that to happen? The analogy I use with a lot of patients is like, hey, say there was a fire in the back room and the alarm's going off. If I just turn the alarm off, did I put out the fire? I did not, right? And so that's what medication aims to do, is to just turn the alarm off, but not actually get to the root cause of why that alarm's going off. And so we're going to look into, kind of what we call like the big four. What is the metabolic situation, right? What's blood sugar doing? Mitochondrial dysfunction is a big one that people experience that is very difficult to test for. Thyroid is huge. It's maybe like 60% of people nowadays have some type of thyroid dysfunction or autoimmunity. And then toxins is a big one. The environment, the world we live in right now it's impossible almost to avoid exposure to toxins from the air, the things we put on and in our body, and even the clothes we're wearing. So from there, you get some data, and then you start to understand, like, okay, like, how is this now attributing to those symptoms? And now we can put together a plan, right, to be able to, right that and rebalance and find equilibrium within the body.
Yes, definitely. It's all about thinking about the root cause. I've never actually heard someone talk about it with the fire alarm and then finding like the cause of the fire, but I think that that's a great analogy, and I mean, it's something you should consider maybe even just trademarking, because that's amazing. Yeah.
Yeah.
So how do you differentiate between inflammation that is a symptom versus inflammation that could be a driver of chronic disease, or is there a difference between the two?
Yeah, I think there is a difference. Again, inflammation is a good thing in short amounts, right? Like, you sprain your ankle or you get stung by a bee. You want that inflammation to go to the source, right? And your body to use its immune system to fix that. But when it's chronically elevated for long periods of time and it becomes systemic, then yeah, there's a problem, right? Your body's not meant to be in that high state of chronic inflammation and stress. And so, kind of going back to that analogy, right? Inflammation can be both the fire and the alarm, right? You can feel inflammation. Your joints are achy and sore, right? You can feel like your gut, you have IBS, maybe you're running to the bathroom 5-6 times a day. And then if it starts to stick around long enough is where then, yeah, long-term damage. And so, again, testing is key, right? Like signs and symptoms are good, and it's a subjective analysis from a patient if they are in tune with their body. But then let's accurately test and get data. And so we do look at some really in-depth, really cool tests within our office. And again, it's maybe a little bit broader than what you're going to get with insurance-based medical care, because when the insurance company's telling you what to do, right, they're like, oh, we're gonna look at these few things. It's like, no, I need more, right? I need to, if I want to determine whether a movie is good, am I going to just watch the first 5 minutes, or am I going to watch the whole thing? Right. So I need the whole picture of before I can make a judgment call if I actually like that film. So kind of the same concept. I need to see a broader picture to be able to determine what's actually going on.
And then, talking more about what's actually going on, let's talk about gut health. So, how does gut health play in terms of like long-term health outcomes? And how can you assess it from a functional medicine perspective?
Yeah, great question. The gut is, again, it's like our first line of defense. Statistics are somewhere like 80 to 85% of your immune system is actually housed in the gut. And so it's constantly this feedback mechanism from your gut to your brain, right? The gut is actually probably your first brain. It's controlling more of our body's daily things than even our brain does, right? And there's more of these organisms and neurosynapses that are actually creating in the gut versus in the brain. And so that constant feedback, the gut is paramount to long-term health. If your gut is inflamed, if your gut is dysfunctional, if you have leaky gut, it's going to affect everything. It is one of the major drivers of autoimmune conditions, which is where your body's attacking itself. And so when it comes to testing, again, it's like starting with some symptoms is good, but then we like to get some in-depth testing using things like stool tests, where we can see the balance between good and bad bacterial flora. We can look for parasites. We can look for toxins. We can look for mold, fungus, all these kind of things. Yeast is a big one. And, realistically, I'd say maybe like 75 to 80%. This is just a kind of a guess number, but of the patients that come in with any type of functional medicine, issues, we're focusing on the gut heavily on the front end. And so it's about like, okay, you get the gut clean. We take them through what we call like our 5 R's. And I can name it. It's, we remove, right? So that's like get rid of the things that are offending the body or the gut, replace, start putting good stuff in that the body can use and rebuild with, re-inoculate, right? Good bacteria, probiotics, some of those buzzwords people are probably familiar with. Then we re-inoculate with, healthy foods and things that are healing. And then again, repair and rebalance. And so when we go through this protocol, it's actually, this has been used for a long time in functional and Eastern medicine. The body can then heal. And so really that's probably 90% of patients are going to go through some type of detoxification 5R protocol when it comes to healing the gut.
Yeah, and going a little off script, but I wanted to ask your perspective on, the use of probiotics, prebiotics, and postbiotics. How do you view that for, patients who are coming into your clinic? Is it like, we want to, put most patients on these, all patients? I hear quite a lot of different perspectives. Would love to hear yours.
Yeah, probiotics are awesome because they have so many different functions, right? The way that certain things are broken down and utilized within the body is controlled by the bacterial colonies in our gut. And so certain bacteria can affect certain things. And so we use different strains at different times within the protocol. But one thing I want to make sure people are aware of is like if you have bloating, if you have diarrhea, constipation, or any type of like gut distress, and then you see an ad on Facebook or Instagram, probiotics fix my gut. People just think that that's kind of like a one-stop shop pill, right? You just take that pill, it's going to fix your problem. Maybe, but maybe it's the wrong timing, right? If you start putting probiotics into a dysbiotic gut system, you're kind of feeding that bad bacteria a little bit. And it's almost like pouring gasoline on a fire. You can make the problem worse. And so I see that a lot. Patients are like, yeah, I tried to take this probiotic and my bloating got worse, or I felt more inflamed. And it's because it was right product, wrong time, right? And so there is an order and a sequence of events you need to go through.
Definitely. And you mentioned a little bit in the beginning about your own experience with Hashimoto's. So can you talk a little bit about hormonal imbalances and how they can often be downstream effects of dysfunction? And how do you approach someone who has like a hormone imbalance?
Yeah, again, right? Like, so in my situation, it was very much that I had leaky gut, which is where the barrier that controls kind of what your gut allows to get into your bloodstream was weak, and undigested, protein strands and larger molecules, even bacteria and pathogens can then get into the blood. Your body is smart. It's going to mount an immune response to that, right? It doesn't want that in your bloodstream. And so when that immune response is chronically going on all the time, your body can get confused. And those proteins that are in the blood can look similar to other proteins that make up our body. We see this in rheumatoid arthritis. The tendon and cartilage proteins, right, start to get attacked by our own immune system. That's what autoimmunity is, right? It's our body attacking itself. And so again, like, yes, addressing gut number one with any type of hormone imbalance, healing and sealing the gut. And then looking upstream into like, what is the cascade doing, right? If I just look at someone's sex hormones and say, oh, they have low T, for example, right? I'm going to just put them on testosterone. Again, that's a very kind of rudimentary, just basic look. It's like, I want to see how is their adrenal stress response maybe hijacking that, right? Because cholesterol through the melatonate pathway creates those sex hormones, right? And so if we have low cholesterol, if we're on a statin drug, it's inhibiting our body the ability to convert now cholesterol into sex hormones. And so, again, you're not going to just throw somebody at something and think that's the answer. It's like, how do we get to the bottom of it? And so, yeah, that's the way we'd approach it. I know it's very similar in kind of every situation, but that's because as complex as the body is, it's actually pretty simple too. It's like the body wants to be in balance. And so remove the bad stuff that's hurting it and then replace with good things and ultimately find that balanced state.
Definitely. And I'd love to hear a little bit more about, when you're seeing patients in your clinic, is it oftentimes that they've seen a lot of other providers and now they're turning to functional medicine as, almost like they've kind of exhausted their other, options, and now they're finding functional medicine as, something that they want to explore? Or, how does that process work when you have patients walking through the door, and what's their previous experience?
Yeah, I'd say that's a majority, like probably a pretty big majority of the patients we see. They've, because that's you and I probably both, right? Grew up in more of the conventional medicine model. Oh, you sprained your ankle. Oh, you got an injury. Here's an Aleve. Here's an Advil. Go to your doc. They'll give you maybe like some type of Z-Pack if you have a cold. And so we're just used to that, and it's kind of ingrained in us. And so people usually go that route first, right? Unless, say, they are out of the box thinking and they come to functional medicine first. That's just not often. So yeah, they've probably gone down the rabbit hole of visit to visit, specialist to specialist. And again, these docs are looking at one specific area that is their specialty, not connecting the dots and the pieces of what makes the person a person. And so yeah, we kind of get that a lot, the frustration piece of, man, I have no answers, and I've been to 8 doctors and a million tests and invasive tests, like people getting a lot of, colonoscopies and things kind of stuck in places you don't want them, right? And no answers from that. And it's unfortunate. And so we always want to start with like, hey, we're here to listen to you first, and really kind of get to the bottom of this. And we're also honest, if it's something we can't help with, we're not going to claim to be able to help you, but majority of the time there is an answer within functional medicine. And so yeah, to answer the question, yes, like that is a overwhelming majority of what we see. And so where we lead to then normally is like, okay, what do I need to see to make a good determination of what's going on here? And that's, again, the testing piece. And then coming up with some type of program for the patient, including whether it's dietary, movement-based, lifestyle-based, stress reduction, toxin removal, all of that.
Probably a combination of most of those things too, because
Yes.
at the end of the day, it's so important to personalize protocols and personalize the entire experience, because each person really does have quite a different, constitution and, list of concerns that they want to address. So what
That's
are some
right.
of your go-to strategies or frameworks when you're thinking about personalizing the, experience and the protocols per patient?
Yeah, cool question. The framework, or like the system and the protocols we use, is very much a framework, and then we add or remove based on the person, right? So not everybody's going to get the same exact kind of approach, but the frame of it, the foundation of it's going to look the same. We got to test, right? I need data. What gets measured can get managed. Then we need to remove the interference or the offensive things that are causing the stress on the system. Support the systems with, say, nutraceuticals or peptides or whatever it might be. And then again, retest, right? And it's like, you want to see that what you're doing is working. So you can't just kind of throw a bunch of things at it and be like, yeah, you're good. Symptoms are a bit of the story, but the data tells a lot as well. And that's how we can be more proactive with people. You solve a problem, and then it's like, hey, now we want to maintain a level of diligence and looking at this every 6 months. We recommend blood work be done, even if it's just a kind of a comprehensive panel, not as much the gut stuff, but just knowing, hey, are things trending in the right direction? Are we having kind of a backtrack of these things? So and then, everything we do is test-based, protocol-driven, and then high accountability. Like, my patients have access to us 24/7 if they need. And we also make sure we're kind of on top of them. We're like a coach, like, hey, did you do your 10 push-ups, right? Like, we're making sure, are you doing the things we told you? Because that's the only way this is going to work.
And I think oftentimes what falls through the cracks is based on compliance, because people are only seeing their providers, once a year, maybe
Yeah,
twice a year. And so, when they're not seeing their provider, they don't have that access or accountability to actually engage with their provider. They might, forget the suggestion, or, they might just not be able to figure out a way or a strategy to actually build it into their daily life. So I think that, kind of one-on-one, or that experience of actually working with a patient and being available to them, is just so important for their success.
Yeah, it's the 21st century, right? Like we have technology. So be like, look at this. We just hopped on a video call and we're across the states from each other, and this did not take any time at all. So, we want that availability piece to be known to our patients. Like, hey, if you have something urgent, you reach out. We respond within 12, 24 hours. We have a text-based system, we have an email-based system, we have chat. Like that, you're going to get a hold of a member of my team and get the answer you're looking for. Shorter than trying to call and make an appointment, right?
Yeah.
So, and sometimes it's something that you don't need to call and come in and make an appointment. You just needed to figure out, hey, what's the dosage here I need to take? Or like, hey, how long am I doing this thing for? Right? What did you say about that again, doc? Right? And so then it's just a quick answer, back on track.
Yes, definitely. And what would you say to providers who are interested in learning more about functional medicine or even integrating some of the principles into what they do? How can they start learning about it?
Yeah, I think step one is like you got to think outside the box a little bit. Medical docs, and I hate to pick on conventional medicine, but it is just kind of the truth of how it's done. Is it's really like a program system that they're kind of like stuck in, and it's like they're kind of told how to think. Versus like, hey, like why don't I think a little bit differently here? What could really get this person better? And so the way I started with this was, I thought about how many people are going to the ER with chronic low back pain. And it was an alarming number. Somebody taking up a seat in the emergency room from someone who needs urgent care, is maybe bleeding, is maybe has like some serious like infection. And now there's someone in front of them who has low back pain that could be solved by some therapeutic traction or chiropractic care, right? And so, being able to direct people better, asking better questions instead of just like, oh, like, this is this, I normally just give this person that kind of thing. It's like, no, like let's dig in. What is their lifestyle, right? Is this person chronically stressed because they're going through something in their personal life, right? Maybe they just got fired, maybe they have this heavy burden emotionally, right, mentally, and that is now psychosomatically exposing itself in a physical way. And so then again, like you ask better questions to direct, like, what kind of investigation do we need to do? And so looking at more, again, I'm always like, get as much data as possible, right? You watch movies, we all watch movies. Like, you don't watch 5 minutes of a movie. I always come back to this. It's like, you don't watch 5 minutes of a movie or a trailer and be like, oh, I loved it. You have to watch the whole thing, and then maybe the ending sucks and you didn't like that movie, right? And so it's like you have to get the full picture before you can make really a determination or an educated decision. And so it's not about rejecting that conventional medicine model, but it's about like really evolving it and getting back to the basics of listening to the patient, spending time with them. I think so many patients are rushed and forced and kind of, taken through just this conveyor belt, and then treating the person, not the numbers, right? Just because there's a lab value that's high, I want to make sure a protocol fits into their lifestyle. I'm not going to give somebody something they can't handle. And so that's very important as well.
Yes, definitely. And I would love to ask your perspective on muscle health. So how does muscle health fit into, what you do as a functional medicine specialist? And, particularly as it pertains to aging, metabolism, and hormones, which we touched a little bit on before, but could you talk a little bit more about that?
Yeah, definitely. And obviously that makes sense with the power panel here, that right, the MYOS MD sponsored. We use MYOS MD a lot because we do see more of an aging population or an older population. And as we stop moving, or as people stop engaging in resistance training, you are going to have that natural loss of muscle mass over time. And really, muscle is your metabolic engine. It's how your body is able to maintain longevity. It's armor, right? You have more muscle on your body, you're less likely to fall and get injured. You are less likely to develop diabetes or insulin resistance, because muscle makes your body more sensitive to insulin. It's utilizing that glucose. And so very much so, we focus on muscle anytime we're going through a functional medicine protocol, because we want to get people more metabolically healthy. We want to lower insulin resistance, improve sensitivity, and we want to support their ability to move and to activate, in whatever it might be, whatever hobby they have, right? It tends to be pickleball nowadays. So it's like everybody's playing pickleball, but you got to have the muscle to be able to perform. So it's huge. It's a staple in what we focus on.
Definitely. And could you share like one or two success stories that you've had using MyOS MD?
Yeah, definitely. One guy came in and he was gosh, I can't remember his age, 60s. I'm just going to say mid 60s, and baseball player throughout his whole life, and now was playing like fast pitch softball because he wanted to maintain obviously that game. He loved, it was his thing, and had a couple injuries, definitely had a couple discs. That is why he sought us out. And so we did a protocol of some chiropractic, spinal decompression and stuff with him. And then he started asking questions on like, hey man, like I feel like I'm always sore, or I feel like I'm always having these, like my recovery is not what it used to be. And I was like, well, you are 65, right? And so like, it's not going to be what you were when you're 25, but we can enhance it, and we can, start to reverse some of those effects that you're getting. And so he dialed in on the MYOS MD and was, he was doing 2 or 3 scoops a day, which I told him maybe is, a little overkill, but I was like, hey, if you're liking it, go for it. But, yeah, he did really well with it, and he was able to perform at a higher level, was the feedback we got from him. And he felt that his recovery was faster, which is awesome at 65 years old, right? He didn't feel like he would go play a couple games of softball at night and then the next day be out for 4 days, right? And so myself too, awesome success story. When I had my 2 boys, I have twin boys, and before they were born, I was like, I got to get in the best shape of my life, right? So that like I can just, be there to support and obviously be ahead of this thing. And so I did a protocol of the MYOS for about 6 months, and I probably stacked a good like 5 to 10 pounds of muscle through that process. I was resistance training heavy, and I was, probably the best shape of my life at that point, right about to have my kids too. And then I maintained it through, which was awesome. So it's a great product, and something that we definitely incorporate in.
Amazing. Thank you so much for sharing. So this was a very quick 30 minutes, very quick session. But as we wrap up, we'd like to thank MYOS MD for sponsoring today's Power Panel. Fueled by the proprietary ingredient Fortitropin, MYOS MD is trusted by healthcare professionals like our guest, Dr. Alessi, to deliver real results backed by science. So if you'd like to learn more about MYOS MD, you can go to the website myosmd.com, where we have a number of other recordings, both there and on our YouTube channel, and you can learn more about bringing this powerful solution to your practice. And so if people want to learn more about you, Dr. Alessi, how can they do that?
Yeah, so a few different ways. Our website is alessifunctionalhealth.com. In the functional medicine side of things, we do telehealth as well. So, we have patients from all over the country. With the physical medicine side, obviously primarily in Tampa, Florida. So if you're in the area, and then we have a podcast as well that we educate on kind of how we operate within our clinics and some success stories from patients. That's called Health Decoded. You can listen to that YouTube or anywhere else you get your podcasts. We're on all platforms. And I'm Dr. Alfred Alessi on Instagram. You can follow me and kind of see some things going on within the clinic, which is really cool as well.
Oh, thank you so much, Dr. Alessi. This was a great conversation. We talked about everything from functional medicine all the way to muscle health. So anyone who's listening to either the live or the recording, please do not hesitate to reach out to either of us to learn more. Alrighty, well, have a good rest of the day. Bye-bye.
Thank you so much. You have a great day.